Well, thank you again. Welcome, everyone. We have a great honor of having Dr. Kevin Phung join us today. Dr. Phung has a lifelong passion for education and committed to medical student and resident training. Dr. Phung is a graduate of UC Berkeley, majoring in molecular cell biology, or commonly known by the cool kids at MCB. After completing his medical degree at the University of California, San Francisco, and his OBGYN residency at UC San Diego, Dr. Fong joined Keck School of Medicine at USC faculty and is assistant professor of clinical obstetrics and gynecology in 2016. He is currently the clerkship director of the OBGYN clerkship and assistant dean of admission at Keck School of Medicine. He is a two-time winner of the Arnold E. Gold Foundation Humanism and Excellence in Teaching Award in 2014 and 2016, as well as the APGO Excellence in Teaching Award in 2018 and 2023. Dr. Fong was inducted into Alpha Omega Alpha Medical Honor Society that was voted by the class of 2020. And he's also the recipient of the Leonard Coe Humanism Medicine Award. Um, in 2024, Dr. Fong was awarded the Kaiser uh, Permanente Excellence in Teaching Award for Clinical Science and voted by the graduating class, which was voted on by the graduating class. By end of 2025, Dr. Fong will also complete his doctorate in education from USC Rossier School of Education with his dissertation focusing on surgical coaching. Great honor that you get to join us.
Yes, thank you so much, Juven. It's a pleasure to be here and to talk to all the aspiring medical students. Should I go ahead and share? So it's nice to meet everybody. I want to give a little bit of an intro of who I am and kind of give you my background as being a little bit of a kind of a new generation of physician educators. Let's see if I can share screen. Will you let me? Okay, perfect. Okay, so I made a little slideshow and give you a little bit of background about me as a person and my route through education from high school on. So that's where we are, Keck School of Medicine. This is me. So I am the child of two Vietnamese refugees. I was born in Detroit, Michigan, where my dad went back to school. When he came here, he was a doctor in Vietnam and had to retrain in America. So that's where we all were born when he was at Wayne State University. I grew up in Orange County, not far from LA, in Laguna Hills. And this is me as a kid, and I graduated in 2003 from high school. I then went to undergrad at UC Berkeley. Um, and from 2003 2007, this is a picture of me at our graduation for Southeast Asian students. And then I also was part of the Taekwondo team in which I competed at the collegiate level for 3 out of my 4 years. Didn't compete was when I took the MCAT. I needed a break for that, but I did Taekwondo for 12 years as a big part of my story. And then I was very fortunate to go to UCSF for medical school. It's a picture of me and my dad at my white coat ceremony, which is the first week of medical school. You receive your white coat. And then this is me and my sister at the end in 2012 when I was graduating. I then did my first year of residency, my intern year in Dallas, Texas, at a place called UT Southwestern, also known as Parkland Memorial Hospital. For anybody that's a history buff, this is the same hospital that John F. Kennedy went to when he was shot in Dallas. And so it was actually a very interesting historic place to train for my first year. And then I went to UC San Diego, where I was able to join my brother. So this was a lot of fun. I completed my residency at UC San Diego. My brother is a palliative care doctor. He does hospice and a life care, and I do obstetrics and gynecology. So it's kind of a funny. I'm the beginning of life, and he does the end of life. and we took pictures together while we were
So
working
you
together.
do the birth and he takes care of the tomb.
Yes. So it's very funny. And so I end up we shared an office together in my senior year that at San Diego, and we both had the same ID badges. And actually now, funny enough, he's the director of palliative care at USC as well, and at Keck Hospital and Norris Cancer Hospital. And we people confuse us very often.
You guys could be a law firm, like a Fong and
Yeah,
Fong.
Fung, yes. Yeah, we may be taking over. So here is my brother. We're at UCSD's graduation here with my mom. They reserved me a parking spot for an award ceremony. And that's when you know you make it, when they reserve a parking spot for you. So, and then since 2016, my first job after graduation was at USC. So I've been very lucky to be here for the last 9 years. It's been a great part of my my academic journey. I love it here. And so this is my parents and my brother watching me at an award ceremony. And what do I focus on now? So I have a kind of a double-headed focus. I do a lot of medical education, which is what I got involved in. It's also why I went back to school to pursue my doctorate in education, also known as an EDD. Sometimes people also call it like a PhD in education, but those are equivalent. So this is I do a lot of mentoring, advising of students trying to go into residency from first year all the way to fourth year, and I also teach residents as well. So I actually teach over 8 years of trainees. It's a really great, that's like teaching first grade to eighth grade, and it's a lot of fun. These are a lot of my medical students that are interested in going into OBGYN. So I have meetings with them and have them meet with some of our other faculty members and people that are in the field. I also, from a training standpoint, do minimally invasive gynecologic surgery. So I do robotic surgery and laparoscopic surgery. That's my clinical practice at LA General Medical Center. So when I'm not teaching in the classroom or lecturing, that I am doing surgery and I'm in clinic. And here's more pictures on the left. Actually, we took some high school students who wanted to see what robotic surgery was about. So we let them kind of see the inside of the operating room and see robotic surgery. And on the right is one of my robotic surgery mentors. We're cutting cow tongues out of small holes. Minimally invasive surgery, you only have small holes when you do surgery. So you have to get creative on how to remove specimens. And then, oh, I have a pop quiz. Okay, great. And then lastly, I was doing obstetrics for the first 8 years of my career, and now this past year I have stepped away from it. But I used to do a lot of baby delivery and C-sections. And you can see here, let me see if I can see it on the screen. That is a brand new baby that was born probably just a couple minutes before. And then that's me right there, supervising the C-section. So that's it. So that's kind of where I want to kind of introduce myself. I do have a little bit of a talk about like what we care about, what we look for in the ideal applicant. I don't need to go right into that right now, but I'll kind of stop there for a minute. Unless you want me to go into what we care about.
Yeah, yeah, go ahead. Yeah.
Yeah, okay. All right. Well, I'll give you an overview because the start of this talk is um aspiration to admission and what it actually takes to get into medical school, what we're actually looking for. So when it comes to what all medical schools are supposed to be looking for, and when it comes to USC and Keck School of Medicine, we are in the east side of in East LA. We serve as a very amazing community of diverse communities, ethnicities, Spanish speaking, Korean speaking. We also take care of the unhoused population in Skid Row. We also take care of the incarcerated population in the LA jail system. So we are considered a safety net hospital that takes care of all the underserved, uninsured, or underinsured populations in LA. In fact, if you have insurance, you can actually not be seen more than twice at LA General because we need to leave room for people, and that's the main hospital that we affiliate with. We also have Keck Hospital and now Arcadia Hospital to show the private side of medicine. But what's really important when it comes to what we're looking for in a prospective applicant is someone that shows a commitment to service. And so what does that mean? It means spending your time and doing activities that are working for the greater community. When you're working or advocating for groups that are again, like we talked about, underserved or are at need, whether that be, like I'm an educator, so I care a lot about, junior high students, high school students that are aspiring as well to go into medicine, and helping them. We partner a lot with East LA Women's Shelter as an OBGYN, so they do a lot of great work with clothing drives for women. They are a shelter. They help them with feminine products. We provide support for people that may be in domestic violence cases. Volunteering at hospitals, volunteering at food drives, homeless shelters, homeless clinics. We really want to see that people understand that you are part of a bigger, something bigger than yourself. And so that aspect of a commitment to service, whatever type of community service that is, and is an important aspect of the application. In which case, if you don't have that, it would be a big lacking in your application. And so there are a lot of ways to get involved, and a lot of organizations, non-governmental organizations, nonprofit organizations that are doing a lot of good work to help people that are in need, communities that are in need, and people that are, again, anything that we can do to alleviate that suffering on a larger scale is an important aspect of an applicant's story. In my time at UC Berkeley, I spent several years and even stayed after I graduated working at the Suitcase Clinic, which is a homeless clinic right outside of Berkeley, in which we provided services, both food, we've provided podiatry services, optometry services, and also medical services to the homeless population in Berkeley. And I was part of that organization for at least half of my time there at Berkeley. That's really important. I also did a lot of tutoring, study grouping, and that was, the education side of me is always part of my story. So those things are, showing that I had this commitment to working with the group. Also, I think people that are involved in religious organizations, or camps or anything like that, those are people that do good work, working with special needs populations and that sort of thing. So you can kind of see what we are looking for. We're looking for people that show not only the type of work that they do, but the duration in which they do it. That matters. So doing something for a summer is okay, but it doesn't show me that there is a long-term commitment to that organization or that work, right? That line of work. So it is important to not only get involved in things when you're in your community college, or when you transfer to a four-year college, if that's part of your plan, to get involved early in your third year or your second year, or your first year, and stick with that for 2 to 3 years, 4 years if you can, because that shows a lot of commitment to that organization and a commitment to that population that you're working with. Okay, maybe I should stop there for a second. Do they ask questions at the end, Jobin, or?
Yeah, as you're speaking, people put questions in the Q&A. So when you're done, I'll go through them and ask them to you.
Okay, great, 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 great. Cool. Are there any right now before I move on to the next competency?
No, you go ahead. Yeah.
Okay, great, great. So service makes a lot of sense. Really important for us to see. Volunteering is good at the local hospitals, ERs. I like to see people that work as EMTs. I like people that are working as like scribes in clinics, MAs, medical assistants. All those things are really great because it's showing me again that the time that being spent, the volunteering time and working for vulnerable populations is important. Shadowing is good. It's important to have some shadowing, but it's not as important as, like, if I see a lot of shadowing and very little service, it's more important to me to see a lot more service and a little bit of shadowing. Because shadowing is a little bit of just walking around and watching the doctor. And that's important to get exposure, don't get me wrong. But it's not the same type of work, right? So I don't want you to confuse the two. Some you're getting involved in more, you're getting, you're breaking a sweat, you're working with people versus shadowing is just exposure. And it's, in my opinion, doesn't show the same dedication to service. Okay, moving on. Empathy, and compassion. So this is something we look for, and it might just come through in your interview, or it might come through in the work that you do. But I think it does matter that we as physicians lead with compassion and we care about people's situations, and that we are able to see ourselves in their footsteps and try to help people, even though you don't need to. Like something my dad says, like, you don't need to help everybody, but if you can, you should, right? And so and I'm not talking about putting yourself last, but it does matter that there is a demonstration that you do care about the people that you're trying to help, that there is some sort of help happening in the services that you do and the organizations, the activities that you're doing. Um, like I see sometimes in applications, I see a lot of um, it's a mixed bag. But if I see a lot of activities that don't really have any relationship to working with other people and helping other people, it doesn't count for as many points in my head as activities that do, right? So I think it's great to have hobbies. I grew up as a musician as well. My mom was a piano teacher, and so I played piano, guitar, violin, and I sang in choir, and so I care about that stuff. And if you have that, I think it's really cool to have aspects outside of just pre-med stuff that make you a person, and you have artistic endeavors and interests. I think that's really important, whether that's dance or whatever. I think that's cool, and sports and that sort of thing. I do count that because that's going to count for later when we care about like teamwork and collaboration. But overall, I need to see activities that show that you are a compassionate person as well. So that matters. So whatever that ends up being, whether it's you're helping with Meals on Wheels or you're helping with, um, suicide hotline people, or you're spending time at elementary school, you're spending time at retirement homes, that sort of thing, um, to show that you care. Okay. This is actually a core competency, and again, not very easy to see on a resume, but something that we care about with when we ask in an interview, we care about ethics and integrity, right? We care about that you're going to do the right thing when nobody's watching. And this is the honor system, the honor code. And I feel like sometimes we live in a society in which people that don't follow the honor code are rewarded. But in medicine, we try to hold ourselves to this higher standard, right? We're one of the few um, professions that still has an oath that we recite, and that we try to hold ourselves to a really high standard of doing the best by the patient, doing no harm. And it's important that there's a lot of trust that patients put in our hands when they are seen by us, when they go under anesthesia and they're unconscious, and we're tasked with, treating them and fixing them. There's a lot of trust that patient puts into my hands, and or the family puts into my hands. So it's important that I know how to act responsibly and act ethically and with integrity. And that might come in the form of us asking you hypothetical situations about what you would do in a certain scenario, or like I said, being in situations where yeah, I think most of the time it's going to be like a ethical dilemma that we present you with, and what do you think about it? And there's like, again, part of it is not always like um, there's a right answer, but being able to see both sides of an ethical dilemma. I'll give you an example. I had a student or an applicant who was talking to me about our training hospital at LA General Hospital, and it's a teaching hospital. So a teaching hospital, unlike a private only hospital where there isn't trainees, the patients are seen by students, by interns or their first year residents, seen by junior residents, senior residents, and then seen by me, right? It's a system, it's a team. And um, this applicant was talking to me during an interview and said he felt that that was an ethical dilemma in his eyes because it felt like these patients at LA General, the county system, the county hospital, who don't have insurance, who can't pay for private insurance, are being kind of, as in his words, experimented on like a guinea pig by trainees and medical students. Yet, if they had private insurance, they can go and get treated by attendings. Attendings are the highest level of physician ranking. Be at a hospital with only attendings, right? And treated by that. And how is that ethical? It's a good question. And how do you fall, and I presented that question to future applicants and I asked them, what do you think about that? Can you see both sides of that argument? Right? Because there isn't really a right answer here, right? I know how I feel about it because I'm an educator. And I believe that one, as long as they're getting equivalent care and that, it doesn't mean that they're getting, half quality care because there's a student talking to them first. There's a supervision there. I always is supervising the students that are working with me. Um, then I think it's okay. And actually, it, there isn't if you look at the larger data, um, a decrease in quality of care when you have a teaching hospital versus not. But from experience, do students and interns make more mistakes than I would? Yeah, that does happen. The idea is that I'm supposed to catch it or I'm supposed to supervise it so it doesn't happen. But you can't hold everyone's hand when they're suturing or something like that, right? So mistakes are going to happen from time to time. How severe depends on it. At the same time, how else are you going to train the next generation of doctors if no patient will ever let a student or a trainee resident operate on them? Then after a few decades, we won't have any doctors. So there is some there are two sides to that coin. And I do think that that's an important aspect to understand. It kind of shows your emotional intelligence to be able to see both sides of an ethical dilemma and be able to articulate why both sides might have a point. But in my opinion, um, we're not experimenting on these patients as guinea pigs. In fact, um, from a practicality standpoint, think about it this way. There's one of me. I work with 4 residents and 3 students in any given day. So I have a team of 8. Um, we see dozens and dozens and dozens of patients each day. If it was just me by myself, how many could I see? Maybe max 20, right? Versus being able to see 80 or 100. So is it really better for them if they have to wait 6 months, 8 months, 10 months to see me? If I'm only seeing them by myself? That doesn't seem to be good for their care either, right? And not everything requires the highest level attending surgeon to take care of it. Maybe they just need to be seen and get a refill on their medications. So it's more important that actually the access to care is there. So something that's important to think about.
And the other argument would be that since you're very young, but at some point you're going to get old and you're going to retire, and who's going to follow up after you? I mean,
Exactly.
if you're not training the next, so that argument could always be made too.
Oh yeah. Oh, absolutely. And that's why the
Or you
government.
could go out and get hit by a car, and
Yeah, exactly.
who's gonna replace you tomorrow? Yeah.
Yeah, and like I said, and I think here's another argument about that. Would you rather have 4 people looking over your paperwork and making sure it's right and making sure the labs are okay and making sure everything's okay? Or would you want one person who's in a rush because he's seeing 20 other people and he might miss something, right? So there's a lot of layers of safety in a training hospital because there's a lot of people looking at your paperwork at the same time, your labs and everything. And so there is, like I said, there's an argument to be made, even though, yeah, sure, I'm working with a first year brand new intern, but I do hold those people's hands a lot closer. And so that's on the institution. And that's why we have a great training institution at USC. Um, Interpersonal skills, really important, right? So we have a lot of smart people that apply, right? These brainiacs, right? The 4.0s, 5.0s, right? Perfect SAT, perfect MCAT people. And you can be the smartest person in the room, but how much does that matter if you can't interact with a patient and be able to communicate a disease process to them or what diabetes is or why it matters to check their blood sugar? Can you communicate to someone that has a third grade reading level? That's what's more important, right? Because if you aren't able to translate that knowledge to somebody and make them understand it and form a relationship, a trusting relationship with a patient, then it really doesn't matter how smart you are. So it's a balance, but the interpersonal skills side of things is where the hard science of math, chemistry, biology, and physics meets the soft skills of listening, being able to talk, empathy, compassion, like we talked about before, but being able to have this conversation. What we call it bedside manner in the hospital, right? I don't know if any of you are old enough to have watched the show House MD from a long time ago. Great show. Hugh Laurie, great actor, but he's a flawed hero, right? He's the main character, and he's a really big jerk. He's a jerk to everybody, and he thinks everybody's lying, and he thinks all of his patients are lying to him. And I would say that that makes for good TV, but it would make for a very bad doctor in modern day. Nobody wants to come. Is anyone going to come back to your visit, your follow-up visit, if you're a jerk to them every time you see them? It's not gonna work out well, right? So that's a really important aspect of um, what we see. And so when we interview you, we're looking for that. We're looking for how do you converse with us and how do you play well with others. So I'm going to go into that a little bit more, but that ability, that skill set is what we care about, even though it doesn't show up in a GPA. It doesn't show up on your MCAT score. But interpersonal skills are very important, which is why I think that the activities that you do when you work with populations of people and you work with these student organizations, so important. Because it is, again, it's a skill that is built up and it's really important to be able to, sometimes you have to give bad news to people, right? And you want to have, again, have the practice and the maturity to be able to have conversations with people, both good and bad. Okay, we're moving on. Perfect segue. Teamwork and collaboration. Um, this is so big because gone are the days of like the village doctor that's the only person in town, right? Maybe that was like 1800s medicine where you had even older dating myself, but there's a doctor called Dr. Quinn, Medicine Woman. Do you remember that? I'm sure. No, no. Okay. Way old school show where is like we're talking like Western times and the American West. She was the only doctor in town, and so she like did everything, right? She was a pediatrician, she was an OB, she was a surgeon, she was everything. Um, Medicine is too complex nowadays. We have a doctor for every different type of specialty and subspecialty. But not only that, you're working with a very wide range of healthcare professionals in the hospital, including nurses, advanced practicing nurses like nurse practitioners or midwives. Uh, Midwives are advanced practicing nurses that do obstetrics, so they do child delivery only, and they do low risk child delivery, which is really helpful to us. We work with a lot of techs, scrub techs. Jobin, you're a emergency tech, right? We work with anesthesia techs. We work with scrub techs. They're very important, surgical scrub techs. So they're the ones that organize our surgical instruments and hand us instruments during our surgeries, our C-sections, in which case we wouldn't be able to do the surgeries without them, which sounds odd, right? Because why do you need a person to be in between you and the surgical instruments? Because we have so many. We can have like,
Respiratory tech, lab tech,
yes,
yeah,
yes, yes,
X-ray tech,
arm
MRI,
tech.
ultrasound.
Mhm.
Yeah.
So think about all those different types of technicians and people that are working in the hospital. On top of the anesthesiologists, the pharmacists, and we also have social workers. So every morning on labor and delivery, we round with social workers, anesthesia, pediatricians, the OBs, the nurses, the midwives. The students are there too. I just named off 7, 8 different types of people, right? And what we want to know is that are you a good team player, right? Do you know how to work in a team and be collaborative? Because we don't need the lone wolf that is abrasive to everyone that they talk to, right? We need people that know how to respect other people, even though they're not the MD, right? That's going to really get you far in life if you're able to respect other people's different disciplines. And, even if they're different ages or different training levels, that's going to be really important. And when I talk about being good at teamwork, I don't just mean being a leader. Being a leader is important. And in realities, MDs are often the leaders of a team, right? Or leaders of a code if an emergency is happening. Yes, that's very much the case. However, I would argue that being being a good team player also means making space for other people to shine, right? Getting the best of everybody, getting their expertise, making space for them so they can step up and show you, and kind of step up to their role. I often talk about this being like, do you know how to be a star in your role? Whatever that role is. And I talked about earlier that I do a lot of music related stuff. And so, you look at a band, you have the lead singer, the lead guitarist, and then you have the bass guitarist, you have a drummer, you have somebody on the triangle. What if you're that day you're on the triangle, right? You need to play that triangle just as well. Or maybe you're, sports analogy, you're on a basketball team, but you're coming off the bench. You're not in the starting five. Isn't that role just as important, right? To the team success. So it's really important to be able to understand what it means to be a star in your role because when it comes to joining the medical training system, when you are a third year student or fourth year student on our team, they also have a very important role that they do. It's not just like, oh, I have nothing to offer. Actually, a lot of my students will say they feel like they don't have a lot to offer because they are at the bottom of the totem pole. And I told them not to sell themselves so short because um yeah, I think it's important to recognize that everyone has a role for a reason, and that role for the student standpoint, they might be assigned to one or two patients in that morning where I have again 15 or 20, right? How much time do I have to speak to those 15 or 20 people? Versus how much time do you have when you only have one or two in that whole morning? You have hours to speak to them, right? And maybe it's that time that you spend with them that gets them to build enough trust with you that they then can reveal important information to us that is required for us to treat their condition. We ask a lot of sensitive questions in medicine, especially in OBGYN. We ask about number of sexual partners in the past. We talk about the history of sexually transmitted infections. We ask about whether people feel safe at home or not, right? These are really intimate questions that would really change the management of how we approach them, whether we need to get child protective services involved, whether we need to get social workers involved, whether we need to get the Department of Public Health involved, depending on their answers. So, um, me jumping in and out 5 minutes and seeing them in the morning, they might not feel close enough to me or trust me enough to reveal all that information to me. They might just say yes, no, whatever. But you spend a couple hours with someone or you're pushing with them in labor, suddenly you develop a relationship, and that's a really important aspect of how we treat the whole person. And so, teamwork and collaboration is a really big deal. And you're able to demonstrate ask you on the interview, like, talk to me about a time that you were on a team, what your role was, how you played it, what's the role that you find yourself in, like, are you, when you are on a lab team or you're on a community service team in which you were organizing the events or organizing the food or you're, feeding the volunteers, whatever it is. That's an important aspect to build up. We want to see people that are involved with team in some form or fashion. And in my aspect, I not only worked with teams when it came to volunteering for homeless services, but I also was part of a Taekwondo team, right? So sports teams does matter, like because it tells me a lot about your ability to work in a group. Oral communication, I'll put that kind of similar to interpersonal, except I'll point this out in terms of communication to other physicians and other healthcare professionals. It's so important. I think a lot of times, a lot of smart people get together and they assume that other people know things. They assume knowledge and they assume that there's this, I don't know what it is, but there's a phenomenon that happens that people don't want to bother other people like and with they rather not say anything. They feel like if they tell someone that they might already know that they're insulting their intelligence or something. Um, we need to get away from that because what we know about poor communication is that it is a big um, big reason or source of medical error in this country. I don't know if you have seen articles about medical error being the third leading cause of death, preventable death in America. Um, there's some questions about that study, but at the same time, I think it is very real. And when they look at hospitals and they look at what we call sentinel events are bad things that happen not related to the patient's diagnosis. So these are errors. Um, they're looking at the main reason for those medical errors, and 66% of them are due to the number one reason is due to communication failure. So meaning that the people aren't talking to each other. So this is when like wrong arms get cut off, right? Wrong medications are given, that sort of thing, right? Um, we do not communicate enough. And actually, ironically, and maybe timely as well, NASA did a study uh, with airline um, crashes, right? Airline mistakes and accidents. And it was a 50-year study, and they looked at it and saw that 70% of airline crashes were due to communication failure. So this is not engine failure. This is not weather. Two-thirds, 70% of airline crashes are due to communication failure. And that's unacceptable, right? Because that's two people not talking to each other. So when I talk to my trainees, I tell them to over communicate it, right? Don't assume anything that anyone knows anything until you told them it. Because what's the downside of you over communicating a patient's condition? Oh, thank you. I already got that information this morning. Okay, good. Just want to make sure we're on the same page. I wasted what, 15 seconds of that person's time? Now talk to me about the downside of not of under communicating, right? And this has actually happened in our hospital where a patient of ours was being taken to surgery, and the night attending doctor did not know about it. The morning attending doctor did know about it, but forgot to tell the night doctor. And then the resident working under assumed that the night attending was informed until the patient was in the operating room with no attending. And they called the attending when the attending was asleep and was like, "Hey, we're in the operating room for the surgery we have to do." And the attending was like, "What are you talking about?" Can you imagine that, right? So your like family member is on the table waiting for the attending surgeon and nobody's there and everyone's confused. That's what's happening, right? And so that's a big problem. And what we look for in pre-medical students, as we look for the ideal applicant, we need people that don't do that. We need people that know to communicate, know how to communicate well, right? Clearly, closed loop communication, right? That's why the airline industry had to tighten up so much so that they understood we're not gonna, use squishy language. Let's use affirmative language so we understand each other. So we don't, there's no reason that this should happen. This is a human error that can be fixed. Okay, moving on. So talking is important, communicating is important. Reliability, dependability. This makes a lot of sense. We want to know that you're reliable. We want to know so many people rely on you as a part of the team, right? So if again in the morning, if we divvy up that you're going to see four patients and I'm going to see four patients and they're going to see four patients, and then um you're running late or you're overslept or something like that. We need somebody that is going to be able to, when that happens, like communicate that immediately that something's up, that I'm going to be late or I can't come in today or I'm very sick or something like that. Um, Basically we there needs to be this professionalism there with reliability that again is higher than the standard for your average American, your average layperson. Because you can't just like, you know, if you work at a normal job, If you don't show up or you feel like just last minute calling out or whatever like that, you probably get away with it. And there's not going to be like consequences, severe consequences. In this situation, like this is again, like there's patients relying on you, right? So that's why the ability to be very communicative, be reliable, you're showing up to your shifts on time. You're communicating when you're having issues, even when you're overwhelmed or you need help or whatever. We need to know that if you say you're going to be somewhere, that you're going to be there. So are you able to demonstrate that you have a track record of reliability and dependability, right? Versus the opposite. We don't need flaky people, right? This is the opposite of that. This is the opposite of flaky. This is people that stand by their word, that they're gonna be there when they say they're gonna be there. And yeah, hey, I'll be honest, I was not a morning person. I've never been a morning person. In fact, I've been a night owl since I've been a kid. And I'd stay up playing video games. Even though my mom told me to go to sleep, I'd still be up playing video games, right? And I had to learn in medical school and residency especially how to wake up early and adjust my sleeping schedule and get there not only on time but get there early, because it gives you a little bit more time, a little bit more cushion, and you don't want to be like running like your head cut off everywhere. So really important to be able to, this is what we look for, is what we consider a core competency. Ah, yes, my next favorite topic: resilience and adaptability. So resilience has a lot of you know, ways that you can see resilience, right? Resilience doesn't always have to come in the same way as like my family story, right? Like my dad escaping the Vietnam War, having to start all over in America, that sort of thing. That's a pretty rare, like not everybody has that family story. But what I care about with resilience is how do you respond to failure? How do you respond when something doesn't go your way? In fact, that's one of our secondary questions. When you apply to a USC Keck School of Medicine, we ask you, tell me about a time that you didn't get something that you felt you deserved. And then how did you deal with it? What did you learn from it? How did you move on from it, right? That's important because I'll tell you what is kind of worrisome to me is when I have the perfect student. 4.0, 100% everything top percentile, this, that, and the other. Went to really good school, Ivy League, whatever, right? Has never, ever, ever had a setback in their life. In fact, I remember interviewing the student and asked them, tell me about a time that you failed and or were disappointed in yourself, right? And how did you respond to it? And he waited for a minute and he said, well, I don't think I've ever failed. And I'm like, that's a really bad answer. You probably should come up with something, right? Because that might be true, maybe. Like they never ever ever had adversity in their life, and I'm not talking like adversity in any form, right? Whether it was like you're trying out to be captain, or really wanted to be part of this, get this role or position, or this lab, or this like scholarship or something, or you got beat at a tournament, whatever it is. Um, I need to know how you respond when you get knocked down. That's a really important part of me being able to judge your character. And the reason why is because medicine, the way medicine is taught, it's a lot of failing, what we call failing forward. Um, Actually, Denzel Washington talked about that at a commencement speech. It's like he wants you to fail forward and fail often, right? And that's really one of the best ways to grow is to kind of, how do I, you know, like I'll talk about like my new interns and when they come in and do a C-section with me, for example. There's no way for them to knock that out of the park. Nobody gets 100, an A plus on their first surgery. That's impossible. Because we do a teaching style called C1 do one. So you get a C, let's do one C-section, and the next one is yours. And you can watch as many videos as you want, and you can simulate on a cardboard box as many times as you want, but nothing beats the real thing. And that is how is a teaching style developed in 1889 in John Hopkins, and we've continued that like apprenticeship model since then. See one, do one. It's actually see one, do one, teach one. But that's the third step is really high. So we'll leave it at see one, do one. And when I have a even when I have a great resident, maybe they do 80% of it rock star, but the 20% that they don't do well or they have room for improvement. What I'm interested in, I'm not gonna fully judge them on that first case. What I would judge them by is how do they respond to the feedback I give them? Do they, you know, get defensive, right? Because that's a very difficult learner to teach. Or do they lean into the feedback, go home, think about it, and come back enthusiastic to make adjustments to how they did last time? That's my ideal learner. That's my ideal medical student, right? Someone that, even if they're not the most naturally gifted first off the bat, like I said, I want to know how you respond because that shows me how you're going to be for the rest of your career. That because at every year, that's how it works. We don't put you in a situation where you're comfortable with what you're doing because otherwise you would just be treading water. We need you to move. So every time you're comfortable, we actually graduate you to another level in which you're now uncomfortable again. That's how the training system works, right? The only way to feel comfortable is to stay in the same place or go backwards. So you're constantly going to be in a situation where you're uncomfortable and not really mastering the material. So how do you respond in that environment? That's what I'm looking for with resilience. How do you get back on the horse? And also, as a part of it, I had kind of alluded to this, but do you know how to fill your cup outside of work? Do you know how to recharge your batteries after a long shift? Because medicine's important, but it can't be 100% of your life because that's what leads to burnout. And we know way too much about burnout now to know that if you're just in a grind, and I think that's great that if you're a very hard worker, good at school, that you're trying to get the best grades you can, that's really important. But what's also really important is having some sort of balance to that in which you like to hike or um you like to bake or you swim or you play pickleball. Actually, I'll play pickleball sometimes and see my students on the court, which is kind of funny. I wonder if they let me win on purpose. But
Or
anyway,
taekwondo.
or taekwondo, yeah, right? Taekwondo or I played a lot of guitar in college. Just something because you know why? Because if you are expected to heal other people, how can you heal other people if you're sick yourself? Or how are you supposed to fill other people's cups if your cup is empty? It's not possible. In fact, you'll show up as a lesser version of yourself. Without that compassion, you'll start to get jaded, calloused. We don't want that. So it's really important. I actually look for, and actually this is a part of our secondary application as well, is is tell me three things that or like yeah, tell me the last thing that you did for fun. Tell me something that you did for fun. Right? I kind of want to know like that you are a normal person too. And that you aren't going to burn yourself out when you start medical school because when you're doing in residency, you only get 1 day off a week. 1 day off a week, right? Whether that's Saturday or Sunday. It's not a lot of time off, right? And sometimes you're pushing 60, 80 hours a week, which is double what is normal work week hours for people. But that's part of the sacrifice that we do when we join medicine. So, are you able to then be, like your own advocate, um, practice self-compassion, self-love, and give yourself whatever time you need, whether it's outdoors or massages or whatever you need to do, cooking, whatever it is that you need to do. For me, I like going to concerts to get back to fully charged. Let me talk a little bit about adaptability too. How are we doing on time? We're till 6:30, right?
Yeah, we have about 30 questions so far.
Oh, okay, great. Okay, so we'll go. I'll
So
talk.
yeah, so when you're done, I'll just run through them.
Perfect. Adaptability. I just want to talk about this real quick. Um, Being adaptable is really important. And what do I mean by that? I mean that can you get the job done with the circumstances and the supplies that you have in the moment? What I tell my trainees often is that I want you to feel comfortable operating under suboptimal conditions. And although that sounds kind of weird, what I mean by that is that, sure, in optimal conditions where I have all the time in the world to prepare and I have all the supplies I need and I have all the staff that I need there, I can do anything, right? But there's times where those conditions are not there. They're not ideal. They're not optimal. So, for example, in childbirth, a woman could come in for a scheduled induction of labor or scheduled C-section, and everything's calm and everything's great, and we get everything, and she's comfortable, and we're comfortable, and we have all the time in the world to prepare for her case. And there's a lot of times where women come in and they broke their bag of water at home, and they come in yelling and screaming, and I might have just enough time to put gloves on and deliver them in a hallway, right? That's not ideal. That's not optimal, but I gotta do it. There's no buck behind me. There's nobody behind me that's gonna help pull me, save me. And the patient's relying on you, right? So are you able to still operate in those conditions? Now, I don't mean like we just, you know, uh, accept and settle for substandard conditions. No, let's do the debrief after and see how we can optimize things after the fact. But what I don't want or don't need is someone to be paralyzed in the moment and say that they can't do it because they don't have it, or they're going to complain in the moment because we don't have the right scalpel for me. Oh well, deal with it. Deal with. I've actually done a whole surgery with a disposable scalpel because we didn't have enough time to get the real scalpels, and sometimes you just have to go because the baby is tanking and needs our help immediately. So, so being adaptable, running with it. Hey, or guess what? You might be in the airplane, and all you have is a first aid kit made for an elementary school, right? How do you handle that situation? This is not all the stuff I need normally. Okay, but let's make it work. Can we make it work? Trust in your training, right? Understand that that's an important aspect of like, I can do it. And that's what it means to be adaptable. Few more. Okay. Last few things. Cultural humility, really important. Awareness, cultural awareness, especially at Keck School of Medicine. I would estimate that 80% of our patients are Spanish speaking only or primarily, right? We have a large Korean speaking population from K-Town that are coming in here into the country. Um, we have arguably the most diverse city in the country, right? So it's so important to be able to understand that understanding where these populations are coming from, their background, the history involved. There might be a historic distrust of the medical system from this community, and it might be very justified. And I think your understanding of that is really important. And I don't expect you to know everything at the onset or to speak fluently at the onset or anything like that. But do you recognize that it's important to learn it? Are you trying to pick up phrases so that you can talk to the patients? Because you can't call a translator every single time. Um, but learning a few phrases to introduce yourself or to say it's nice to meet you, like mucho gusto. Or in my line of work, sometimes I have to tell people to push also, like sigue, 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 telling them to encouraging them. That's going to be important and it builds trust with the patients that you work with. So that's really important in providing good care. And last but not least, I think this is goes without speaking, but it's lifelong learning, growth, continual improvement, that sort of thing. Um, you got to keep learning because medicine's always expanding. And we're from a generation in which technology increases so quickly that if you don't stay on top of it, even 5 years, you're going to be behind. And so you're always going to be learning, and it should be something that you enjoy doing or drives you. But a commitment to learning and growth, having a growth mindset, not a fixed mindset, is really important. Okay, I'm going to stop there.
So, couple of questions. Do you want to just is that your dad?
My family, that's my dad. We call
Very
it the Phung
cool.
dynasty. Yeah, he's very cool. Yeah. So both of my brothers here were doctors, and my two brother and sister over here are lawyers. And so we kind of have we
Oh boy,
consider ourselves a Phung dynasty. And my mom's not in this picture, but she's a lawyer too. So we have three doctors in the family and three lawyers in the family.
awesome, cool, good looking family.
Yeah.
All right. So the first question is, as a male physician, how do you go about choosing OBGYN as a specialty?
Oh yeah, that's a good question. A lot of it actually, so it breaks down to I didn't know I was gonna do it. I actually thought I was gonna do radiology like my dad. But I found myself so bored in the dark room reading X-rays that I felt like I needed to change. And I knew I wanted to use my hands because I've always been good with my hands, video games and musical instruments. So I knew I wanted to do something with my hands. So right in the beginning of medical school or in this process of developing, you kind of decide, am I going to do a procedural field or a non-procedural field? And so I that kind of limit that cuts out half of the fields for you. The other thing, coming out of UC Berkeley, I was very politically active too, and I cared about you know, um, movements like the pro-choice movement and that sort of thing. And so I wanted to fight for a cause, whether it's primary care for pediatrics or something like that. So when I was starting to do women's health stuff, that actually checked that box for me because reproductive rights. Now, I didn't realize how big of a fight it was going to be. This is a lot bigger. They don't pick on any other specialties but us, but here we are in 2025. So, I wanted something to have that kind of meaning, big movement meaning. And then lastly, um, it was the skill set of my communication. So I am a very social person and I like to get to know my patients a lot. And some specialties, they don't really value that as much, believe it or not. But like, for example, in anesthesia, they don't care how much you talk to the patient. You're just putting them to sleep, right? And then they forget about the conversation you had with them. So that skill set was kind of lost. And so I realized that in OBGYN, when I was on there and I'm talking to a woman about her labor or her whatever, it's a field where you need to gain trust really quickly within a couple minutes of meeting them. And so people, my mentors and my teachers and attendings told me that I was really good at it and that was special. And so I kind of felt like that was just me being normal. And if that was kind of seen as a good skill set to have, would rather be in a specialty where I was seen as exceptional by just being myself versus in a specialty where that skill set wasn't even valued at all.
Yeah, and also I think I just have a problem with that question because that same question is also asked of a lot of women, like why do women do urology
Oh yeah,
or why they're, or male nurses. And I think that's I don't know. I think in 2025 that's kind of like I mean there's still a lot of the gender, but I think but I also think that as a just as a male patient and a female physician and a female patient and a male physician, you have to make sure that a lot of those things are protected. Like for
yes,
example, doing certain procedures, having chaperones and all
everyone.
those things are all
Yes,
like part of it.
yes.
Um,
And I'll add this real quick. I'll add this too is
mm,
that male privilege is a thing. It's the same thing as having you know privilege in a lot of other ways. But if I'm going to be an ally for women's health and this movement, reproductive health, um, you know, I can use my um, springboard as a male physician. Maybe someone would listen to me more that
yeah.
and give a voice that my female colleagues might not be able to give. So there's that too.
So this is another question. If an applicant has a very high GPA and great extracurricular activities experiences, but their MCAT score is lower than the USC MCAT average, but still higher than the national average, then
Yes.
how would USC look at that applicant?
Okay. Um, so we have internal data that shows that our students that score below a 506 struggle to get through our curriculum. So my advice to you is that we do look at everyone from 506 and above. Our median is 518, which is really high. Our average is actually only 508, but the median is 518. So um, my suggestion would be that if your score is lower than that number, I would advise retaking it to so you can get above. It would be nice if you were maybe in the 510 range. We interview students from all those numbers, from perfect score all the way down to 506, for example. And what we're trying to do is look for gems in the 506, 507, 508, 510, 9, and stuff like that. But the extracurriculars have to outweigh the kind of negative side of a lower MCAT score, right? So that would be my advice. But my other advice would be don't take it, ideally, don't take it more than twice. Because if we see multiple retakes, that's also kind of a bad flag for us. So if you have to retake it, make sure the next time is good. Get a good class or a tutor or something to make sure that you are not. We don't want to see four retakes or something like that. Sometimes that's we might not look at that applicant.
Albert Einstein says if you do the same thing over and over again, you get the same result. That's called insanity.
Yeah.
So if you have taken it, once and you did poorly, if you do the same exact thing. So we did about 7 sessions this last 2 months about MCAT. So go back and watch a lot of them because we have a
Cool.
lot of content for it.
Cool.
And this is not like a, you know, 2 minute response. Um, do you accept Canadian applicants? And if so, what are any specific requirements or considerations for them?
Good question. I don't know off the top of my head. I want to say yes, and also Canadian applicants are part of the American residency match.
AMCAS,
So
yeah.
yeah, so I know that there isn't a problem there. I would have to check. I'm relatively new in this role since July, so I don't have the data on that. I'm sorry to say, but I do know that for Canadian schools and stuff, we look at them almost equivalently when it comes. Um, but I would have to get back to
Yeah, I think this person is a Canadian student studying in the US.
you. Okay.
Um, and I think like most US schools like take Canadian and most US people can apply. It's just funding it. Like Canada has certain restrictions of funding medical education,
Yes.
and that's something you have to ask your province. Um, do all of these activities need to be medical related? What if you're not directly related to practicing medicine, but it's still an activity in serving the communities in need?
Good, very good question. Um, they don't have to be related to medicine, especially with like some service stuff is not always related to medicine. I do like seeing like leadership in those activities. Like I said, like when I see people that are leaders of these like recurrent camps or something where they work with certain types of populations or children or whatever. Yeah, I count all that stuff. I think that matters. I will say that things that are clinically, and clinically is kind of a broad term. It doesn't have to be in the hospital, but clinically relevant. So providing some sort of services or something like that, whether you're doing eye screenings or vaccinations or stuff like that, like that doesn't have to be um, like in the hospital necessarily. But I do think that clinically relevant activities tend to be counted a little bit higher. But I do look at all types of activities, and I look at leadership in those activities. So especially if you have a leadership position in those organizations or activities, or you've been doing it for a long time, and now you're organizing these drives or fundraisers, whatever they are, that counts in my book.
Um, yeah, and I think can you just briefly, this is maybe to get an idea of it, like what happens in medicine when you start as a third year medical student and as a fourth year and as an intern,
Oh yeah,
you're teaching the people below you, but are you still learning? Can you explain a little bit about that process?
sure, a little bit. Yeah, yeah. So first 2 years of medical school are very similar to undergrad. You're taking the classes, you're taking the labs, you're taking the test, you're doing book learning. You're also in anatomy lab, and you do once a week at Keck. We have you see patients and interview them. So you do learn the clinical skills. But when you hit third year is when you're fully immersed in the clinical learning environment. That means that you're working with um, other third year medical students who are the first level medical student. You have fourth year medical students there, which we call sub interns, below intern, right? Sub Is. Then well, after you graduate from medical school, you match into your next university or hospital program. And that's when you become an intern. An intern is also the same thing as a first year resident. So those are the same terminology. And then that's when you are a full-fledged MD. You have a long white coat, you prescribe medicine, and you perform surgery if you're in a surgical field. And now you're learning how to be a doctor. And now you're also teaching the medical students underneath you while learning how to be a doctor and learning from, your other residents. So there's residents in every year, second year residents, third year residents, fourth year residents, like we have. And then after that, you can finish and be done like I did, or you can go to fellowship, which is where you subspecialize. So instead of being just an internal medicine doctor, for example, you can be a cardiologist. So that requires a fellowship, which is another 3 years of training. And you can do multiple fellowships if you want, if you're a glutton for punishment, but you could do another 3 years and then you can be like an interventional cardiologist. And that would be another 2 years on top of that. So it does kind of get there higher up, but basically every level, every year, you're working with people above you and below you. And attendings are at the top that supervise all of it.
So this person wants to know they currently have 250 hours of volunteering in a hospital, is starting a medical scribe position 3 months before an applicant with intent of doing it for a year, a good idea. They're currently a fourth year, and I think they're applying their fourth year, so they're gonna have a gap year. Do they think that's good?
Yeah, I think it's great. Yeah, I like to kind of see some diversity and activity. I think you the scribe job versus volunteering is a different type of exposure. You get a lot of you work a lot more closely with the physicians. You learn a lot of the terminology, and you work kind of really closely with the patient interaction. So I'm a big fan of medical scribing. I think it'd be a good experience. And what I would recommend is, especially when you do it the first 3 months, and then you write about it in your application, and then be sure to indicate that your intention to complete that year. You're working throughout the year so that we know, again, the duration of what you're working is important to us.
So this person has multiple EWs, which is excused withdrawal grades, in writing and science courses throughout the semester due to family circumstances. Since this year, second year college, seems to have settled down and try to complete classes with EW. Um, does EW harm their chances of getting into Keck Medical School? Their admission and records office told them that EWs don't count towards your GPA, which is true. And I know that EW was something that's used quite a bit during COVID, so it's
Yeah,
usually.
yeah. So my opinion, at first glance, when I look at someone's application, I don't ship that closely. What stands out to me more is their GPA. So I think that barring that it's not a ton of them or something like that, I think it's more important to get the GPA. If like your circumstances are such that um, if you go through with the course, it's actually going to plummet your GPA. I would recommend doing what you did, which is not go through with it and then complete the class when you are in a better place to commit yourself to working in that class because I would say GPA is probably one of the most important factors, and not just the actual number, the trend in the number. So let's say you had a rough freshman year. Um, I need to see that you're kicking butt your sophomore, junior, and senior years. That's important to me. So even if your total GPA at the end of the day is lower than some of your applicants, the GPA trend is really important for me to see. Let's say maybe you're a late bloomer and maybe your first and second semesters aren't that great first, second year. I hope not, but let's say that was you had a really rough, or maybe you had a really good freshman year, really rough second year. Um, and you're able to bring it back up, but maybe your overall GPA is low. That's where I would actually consider doing a post bachelor's program, 1 or 2 year program. You get more GPA, and I can see now that you're getting 3.9s, 4.0s in the last times that you were in class, right? So that's really important for me to see. So, we see that a lot sometimes with people that are transfer students as well. Maybe they didn't do so well your first year or something like that. You have to commit yourself to doing better from there on out so that we can see an upwards trend because that upwards trend is something that I use to argue for students, for applicants to get accepted.
And resilience and adaptability is if you get a C in GChem, but you get an A in OChem, that could improve a lot, and you could write about it. Anyways,
Yeah.
is there type of work, uh, if the type of work we do is paid, but it is serving underserved populations, how would that look on an applicant? Um,
Yeah, I'm fine with that. Yeah, it doesn't have to be, you
Shoot,
know,
if you're doing work and you're getting paid, like,
great.
I mean,
Just
when somebody pays you means that you had to like go through some sort of screening
yeah,
process. You have to meet qualifications. You have to have some sort of certification.
yeah, yeah,
You're accountable. You are responsible. What else? And you're liable for the work that you do. So
yeah.
it's like, shoot, if you get paid, why not? Like the thing is, this whole thing is, and I know this because I read it on some of the boards, and I know advisors tell you this. It's like you have to volunteer because if it's not volunteered, then it's not pure. I would just say that if you have to put a roof over your head and food in your stomach, you need to get paid. And there's only 168 hours in a week. So if you could kill if you could kill two birds with one stone, like do it and don't feel bad about it. Like there's no like they don't ask you to like be homeless, say I was homeless because I was volunteering. It's like no, if you get paid for doing that kind of work, like do it. This yeah,
Yeah,
God.
I agree. Your EMT getting paid for it, awesome. You can volunteer at some events and do that too, but I'm not going to hold it against you that you're working as an EMT. I think that's great, right?
uh
For example.
this the one if it's okay to volunteer a 1 day a week for a couple hours at an elementary school for 4 years when I was in high school. Gosh, these people supposed to know, should they mention the work that they did, volunteering they did in high school?
I would say it would only be relevant if you're still doing it. Then that would show me that you've been connected to this organization since high school. But I would if it was just high school and you're kind of no connect. I mean, unless it's really really big and you did some really big organization for like Red Cross or something like that, like early on. But I look at like I think a lot of people. I'm looking at college level stuff and the years following college, right, which is your gap years. I think that's going to be really important. But um, again, like if that is your situation. And even then, I would say that's probably that's okay, but not the strongest type of service that I would see. Unless, like I said, like maybe you go back and you involve yourself and you kind of reinvigorate it and do something else. But like when people just go like play with kids at elementary school, and I've done that, and I did some like curriculum stuff. Like I need to sometimes I need to see a little bit more than that, you know. So um that's where I think it is nice to have it be related to something like you're teaching health diet or something like you're teaching healthy stuff or you're teaching sex ed or something that's where having it be somewhat related to health is important. Diet, fitness, exercise, sexual education, not just or teaching the math, science, something like that. Um, Not just that you're playing with kids in elementary school.
No, I had a friend who is actually a medical student now, but she's a yoga instructor and she would go do yoga at the elementary school or junior high. But anyways, this
Yeah.
is actually a follow up in that line. This person is someone who's interested in education and is substitute teaching an activity that is valued as much as daycare after school teaching job because the relationship is not that long term. Um, Gosh, being a substitute teacher, that's again, that means that you have gone through a screening process, you're certified, the school district trusts you, you get
Yeah.
some sort of emergency teaching
Oh,
credential.
yeah.
And there's this organization called Teach for America that these
Yes.
kids have like the highest number of getting into graduate school than any other program because they go for 2 years in underserved communities and
Yes.
teach.
Yes.
So yeah, I mean, and obviously like teaching in high school, you have to have a different mentality. You have to, versus elementary school and after school. I mean, like, and but if elementary school, if that's the age that you like, do that. Like, don't, do what you enjoy doing more than anything. Um, this person wants to know, does service includes clinical and employment? I work in a hospital full time, which limits my time to volunteer, but it's also occurred multiple hours working in the OR and shadowing physicians and surgeons. Do I need to go do more? It's like, you're getting paid to be in a hospital. Like you got this thing called a badge that pretty much gives you access everywhere. Like, why are you fretting?
Yeah, no, I think that's it depends on what that student does in the hospital, but it sounds like if you're getting paid to do it, you're
I think
getting
they're OR 8 or something. It's
yeah,
like,
yeah,
shoot.
yeah. That's great. No, clinical experience is highly, highly valued.
I
So
mean, I tell you guys this, if you guys want to get a job in a hospital that is like the shortest amount, it's 4 hours of becoming a CPR, 4 hours or 6 hours, becoming a patient escort, patient transport. That is like the coolest job because they pay you like 20, 25 bucks an hour. And all you do is you push patients from like floors to X-ray, from ER to, to the floors to like one place to the other. It's only like you need to be CPR certified, and then you get this badge, and you're in a hospital, and you run into like you basically you spit and you hit a doctor, and that's like a really great way to know these doctors. And then hey, I'm interested in surgery. Can I come and watch you? Sure, because you've been TB cleared and you've been cleared. You're in a hospital. You have this badge. And the problem with shadowing and those things is and Dr. Fong could, like Dr. Fong could, bring in people inside the hospital. It's kind of an act of God to get people inside of a hospital because you
true.
need to be cleared. You can't be sick. You can't, expose patients. You have to, do HIPAA, all these different things. So it's
Yes.
getting in
Yes.
a hospital is really hard. And so if you can get a badge to get in a hospital as an employee, which as a volunteer, but when you have a volunteer badge, you can't get anywhere in a hospital, but if you have an employee badge, you could open a lot of doors. So that's all I have to say.
Well, yeah, even in like even if you don't have a job starting as a volunteer, you get all those health clearances out of the way, right? You're allowed to be in a lot of spaces that people aren't allowed to be in. And we're talking about vaccine records, that sort of HIPAA, where you learn about privacy laws and you get signed off on that. That's all really important. For that last question about you're working in the hospital, do you need to do other stuff? You're working, it sounds like you're working kind of a full-time job or at least part-time, and you're also I do think that some diversity is important, right? So if you're able to, you don't want to be so one dimensional. Again, you have your work with that job. I think that's great, but it might be good to maybe have your hands in something else too, because the way that we count points and stuff like that. I think you kind of max out depending on how much time you have at a certain organization or something like that. And we might want to see something else. So it might be good to maybe consider doing some other volunteering or some sort of org or something like that. Um, yeah, that's just that, overall, I think it's good to have some diversity in your application.
Yeah, and again, this person's asking about activities. Should they focus on total number or rather cumulative years of involvement? It's kind of like quality versus quantity.
Yeah, good question. Multiple activities with low hour numbers, I tend to disregard. I like to really see leadership positions too. So either you've been in the organization for a long time or you got a leadership position in it, which helps me realize that you're been involved and committed to that organization. Um, I give a lot of like when I see people rise up all the way to be the president or this or that or the captain or this or that, like that does mean a lot to me. So I give a lot of points for that. But yeah, I don't know. I mean, if I see somebody with like a bunch of different shadowing things, I don't give them a point for each of those things. At some point, I kind of have categories in my head. Okay, they did a little bit of shadowing. Okay, they did a little bit of research. They did this service, then that sort of stuff. So yes, there is a component of again, we don't want to be one dimensional. Don't be one dimensional. But if you show me a long-term commitment, like when somebody shows me that they have several thousand hours working in this one lab or several thousand hours working as a, MA or EMT or scribe, I'm like, whoa, okay, that's like I understand where they put a lot of their time. So I will take that into account for sure. Um, but yeah, it's a little bit of a mix, I do yeah, you don't want to just have one activity. So see, can you be a double-headed dragon or something like that, right? That matters.
So this person wants to know how important are non-clinical volunteering is. Like,
Um, it depends on what you mean by clinical, but I do think that like food shelter, that's not clinical, but that still shows me a lot about you as a person. Remember the compassion, empathy side of things. So I do think that working shelters, that sort of thing, that's not necessarily clinical, but that's kind of that type of volunteering does get noticed.
But also that means don't run into the first shelter to volunteer because you think that's going to look good. Like do the things that you enjoy doing.
Yes,
Like
yes, 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 yes.
somebody in there asked a question about they really like drawing and illustrating. Is that like a good thing to do? And I'm like, I mean, sure. Like, why not?
Yeah.
They should go read Frank Netter's life story.
Yeah, if you like, okay, I've had a few applicants this past cycle that were involved. My suggestion to you is, are you able to somehow connect this um, passion of yours of drawing and make it somehow relevant to like uh, you know patient wellness or healing or something like that. So I had a student applicant this past year who like they did they volunteered their time like drawing and doing like events for patients as kind of a wellness initiative, and they would like either they made a pamphlet that they passed out, or they had like drawing sessions at the hospital or something like that, or with the kids and working with them, or survivors of like that sort of thing. Is there anything like you can like like you can still use your passion, but can you do it to where it becomes a community service type of activity where you're helping alleviate suffering in some way or the other? Um, but obviously, if you're like the editor of your school's art magazine, that counts in my book. So I give points for that type of leadership. And like again, I like seeing um, uh, interest and artistic interest outside of medicine. But the real two for one is, can you make that relevant? Can people that play piano, they play piano for people at a
Retirement
retirement
communities
home. Yeah, yeah, yeah.
or
Perfect.
people or memory centers. Yeah.
Yes, yes, perfect, right? Can you combine those two things to where now I think it's great that you love to do art and stuff like that. If you make it so that you're now helping people or doing it with, like underserved youth or people that want to go into medicine too, or something like that. I think that shows me a lot about applying your gift and using it to help other people.
Yeah, I mean, this person's also asking, like, they like to draw comics. Like, great. If that's something you're doing, like, figure out a niche to, like, we have a bunch of people in our organization that do flyers and logos and t-shirts and a bunch of other stuff. Like, they're using their talent for that. So, like, it's just kind of like, it's kind of like if you like doing something, like, do it. Don't sit around and think that it's going to look good or not, but find a niche that fill out what is it? Fill out a need that's in there that's needed. This person wants to know they have a low science GPA of 3.2. Should they register for special masters to have a new GPA, or should they apply to medical school and focus on clinical hours, shadowing, volunteer, getting high scores on the MCAT, or would they still have a chance of getting into an MD school?
I would say um, that it would be best if your GPA was over 3.5. So a lot of people will consider a master's or post-bac program to either average out your science GPA or erase your science GPA from your undergrad, depending on how lenient the school is. I will tell you that someone that applies to USC with a 3.2 probably would not be considered. So I think both are important, but I do think that it's probably, if you want to maximize your chances and again show that upwards trend, then I would consider doing that post-bac or master's program to get that science GPA back up.
Um, they want to know what advice do you have for non-traditional students who are coming from unrelated careers?
It's great. Hey, look, USC doesn't have any prerequisites. Right? I love the non-traditional applicant. We do that on purpose because we want people from all different walks of life. My advice to you is get into a post-bac program that will support you, has a good track record of their graduates applying and getting into medical school, a post-bac program that will write you letters of recommendations, that will guide you in the right way, get you good science GPA, and all the while doing the things that we just talked about now, getting involved with those activities, getting good mentorship in that. Yeah, I look for that a lot. People that take gap years, people that worked in AmeriCorps, Peace Corps, all those things coming back, people that are in the military coming back. I look for that. I actually put special weight on that because I feel like it takes a lot for someone to go back and realize that they want to do medicine later. And so from a practicality standpoint, I would say apply to a post-bac, good one, and then go from there.
This person wants to know, is research experience important to apply to medical school?
It's one of the categories. So it's not everything. It's not everything. It'd be nice if you had a little, right? It doesn't have to be medicine related, but just a little bit of research showing me that you presented a poster or spent some time in a lab or an abstract, something like that is good. It counts for points. Um, you don't have to be 1,000 persons in a lab and published everything under the sun. You don't have to do that. A little bit is helpful.
Yeah, and Dr. Barrios, you could go back and watch the video from last week, who's the associate dean at UC Irvine, talked about an hour and a half about why research is important in medicine and for pre-med. This person is a freshman at USC and they're studying biochemistry and they're involved in a couple of clubs and want to get involved in research, but it's hard to find PIs who don't reply. And they want to know what they should do. I would say two things. Welcome to the real world. That
Yeah.
you ask a hundred frogs to get that one prince, and so yeah. And then the other part of it, look at summer programs. The thing with PI is they don't want people that don't have experience because they don't want to sit there and teach you something new, and they don't want you to do it for like 5 hours a week. Because if you're going to school and you're doing all these clubs, you probably have like maybe 5 to 10 hours. So summer is a great opportunity. There's summer programs. I also know that the USC Pre-Health Advising Office could get you some information on that. But I think summer is a great part to do it because you could do it full time and they'll actually like pay you to teach you. So, but also just like if you've only asked like two PIs and you got rejected, like I would say probably you have to look in the double digits, of asking people and making it short and attaching your resume to it.
Yeah,
And
and what my addition to that would be is that it might work out better to maybe the people that you have classes with to talk to those TAs and those professors about research opportunities because you have a relationship with them and you pass their course, and that's how I did my research at Berkeley. I talked to my OChem professor after, and I got into his lab after taking his course, and then I actually TA'd for him as well. So it worked out in my favor.
yeah, and the other thing is you guys that are at the bigger universities, your first year, you have a lot of TAs that are graduate students, and they're the ones actually doing all the research. So your professor may go in like twice a week to the lab and go in there and sits in his office and writes manuscripts and grants. So those graduate students are probably the best people to like, to talk to because they're the ones who know everything about a lab. And most likely you're going to be working with them, not the PI.
Correct.
This person wants to know, isn't considering interpreting in a free clinic a valid primary clinical experience or is it volunteer? They've done like 250 hours for a year and a half. It's like
Say that one time again.
they
What's
they,
valid?
they just want to know that they've been interpreting in a free clinic.
Oh yeah,
Is that a
yeah.
valid
Absolutely.
primary clinical experience?
Sure. Yeah. Yeah, interpreting in a free clinic. That sounds great.
Um, the they they want to know is a high cumulative GPA more valuable have more significance than a good MCAT score? All right. You need to have both. So,
Yeah, you have both. But I will tell you that having a low, again, we sampled from a range of MCATs, but a low GPA is kind of a non-starter. So I would say if you had to pick one, the GPA is more important. It's a 4-year indicator, right? 3 to 4 year indicator of your progress. MCATs, sometimes, some people don't test super well. So if you had to focus on one, make sure your GPA is solid. That's more important in my book.
so this is how can we showcase reliability and dependability in an interview or application?
That's a good point. I think when it comes to activities, and when we start describing your work in an organization or your job or something like that, and how people, yeah, had to rely on you for your services or whatever. Um, it's you kind of taking care of things, being dependable, that sort of thing, organizing things. I think that is part of it. It's almost kind of like mixed in with leadership a little bit, but basically, were you an integral member of a unit or a team or something like that, and what did you do in that? So it's kind of again one of those kind of more um, gray zones or elusive characteristics that we care about, but it is demonstrated in your activities and your explanation of your roles on a team. Like uh, Jubin was talking about with like your involvement as yeah, you're interpreting, and you're there and you're vital to the patient care of the interaction between the patient. Okay, cool. Maybe
Yeah, there's a quote that if it's to be, it's up to me. So if you're like that person that's that's been 250 hours, you could say, hey, I speak Ukrainian, and there's a Ukrainian community, and pretty much nobody in my office, nobody in that clinic spoke Ukrainian, so they scheduled the Ukrainian patients to come in. Like that shows that you're dependable, and so if it's to be, it's up to me. Like if um you were that important person to make that thing happen, that shows reliability and commitment. Um,
yeah.
the people want to know if they are yeah, you guys are asking like, all these questions that you could look up on the MSAR, like, and I'm not gonna like ask those questions, but you could look at it on the MSAR. The couple of people want to ask about oh, I saw that by the way. Wanted to ask about like in terms of like if they're doing um community service or research programs or any of those things, if they're non-medical related, like so like the one I was wondering if they've done sociology research, is that okay?
Yeah,
And sociology, psychology.
yeah, yeah. Like I said, anything that shows me that you can take, that type of research and qualitative research, that's all important too. Just any type of research.
Yeah, and there's this big key buzzword in healthcare medicine. It's called social determinant of health. And that's all, sociology and psychology.
Yeah.
So this is the last question because I actually start work in 20 minutes and Dr. Fong has to go because he had a long day. But if you could go back in time and give one advice to yourself when you're a pre-med student, what it would be?
Yeah, I think I would have I mean, that's a good question. I think I'm really happy with the route that happened for me. I think if I were to I think maybe I would one piece of advice other than like making sure that you enjoy this journey, enjoy what you're doing. You don't want to be like Jubin was saying, don't do everything so that it looks good on paper because you want to have some gratification in what you do and a diversity of what you're doing. Um, you know, leaving a little stuff for like non-medical stuff is kind of good. I did some theater that I thought was fun. I would say I almost joined fraternity that was purely social, and I am glad I didn't. Some people might be part of fraternity, so I don't mean to poo-poo on anything, but I do think that like be mindful of where you uh, dedicate your time. I think it's important to the wellness that we talked about, the making sure that you never drop the ball on your scores, never drop this ball on your grades. That's more important than pledging fraternity. I honestly, when I look at applications, I'm not very impressed when I see fraternities unless they ran the fundraising for community service or something like that. Like they actually did stuff that helped people. Um, I think it's important, there's a lot of social pressures in college. So I do think that it's important that you stay true to yourself, make sure that you know what the eyes on the prize is, that you're trying to do this for your later career. And I would say try to get involved early and be out there, put yourself out there, and be disciplined with your study regimen so that you do have time to go to some of these sessions on Monday night, Wednesday night, Saturday morning. Yeah, it feels good to sleep in. And I don't want you to burn out, but it does show me a difference in a person that was is willing to dedicate their time other than just being a good student. So I would say, my advice, make that as the standard. Look for things to get involved with, but also don't overdo it. I think I felt like I was really, if you need to take an extra semester to graduate, so be it. I don't care. I don't look at how fast it took for you to graduate. That doesn't matter to me. What I look at, your GPA and how many activities and what you're involved in and your MCAT. That's what I'm looking at. So if it took you 4.5 and you needed to go a little slower, and some advisors told me take two sciences and a math and this and that, and they were gonna burn me out. And no, so split it off, did a couple summer schools, finished I graduated in the summer after I walked in spring. And I think that pace was something that I really valued because I wanted to make sure I had time for everything else. And I even took Vietnamese language courses, even though that didn't count for anything. It was important for my cultural growth and personally. So I say make time for some of the fun stuff, enriching stuff, not just pre-med gunner stuff. But I think make sure that what you're doing is also building towards that goal, building the story that is you, who you are as a person, and that will shine through when you finally apply.
Well, thank you very much. Actually, you have to go and I start working 15 minutes. So
Um,
thank you again. It was great seeing you.